Dr. Eric Broadworth, and I'm going to be going over some exercises that you can do to help treat your tennis elbow. These are exercises that have been proven in the research to help and that I recommend to my patients. Now, if you've been dealing with tennis elbow for quite a while, typically if it's been over 2 weeks, I recommend that you get in and get seen by a physical therapist or an orthopedic physician to determine what is the best plan for you. You likely need a plan that is going to be customized to your needs. However, you can give these exercises a try, keeping that in mind though that you should really get in and get seen by a physical therapist for a plan that best suits your needs and to make sure that it is tennis elbow that you're dealing with. So with tennis elbow, or lateral epicondylitis as it's known in the medical field, it is an inflammation and irritation of the wrist extensor tendons here that insert into the lateral epicondyle of the humerus. So the extensor tendons from the wrist, they form that extensor tendon again and insert right there. And when that gets overused or irritated, or if there's any tears there, that's what can create that tennis elbow pain, which can be very aggravating and painful. Now, the first exercise that I'm going to show you is eccentrically controlling the wrist, and we're working on eccentrically strengthening it. So right here, I have a dumbbell. This is about 5 pounds. You could even start off with a can of soup that's 1 pound. So I've got my forearm rested on the armrest here. Okay, I'm going to cock the wrist, so extending the wrist back, and then I'm going to control that motion down at a 3-second count. So you're extending the wrist, and then 1, 2, 3, extend, 1, 2, 3. And I recommend that you do this for typically sets of 10, and you can do 2 to 3 sets. And if that is really easy, then you can bump up the weight. If it's too difficult, you can bump down the weight. But typically about 2 to 3 sets of 10 for that exercise there. Now, the next exercise, this is very similar to the last one. In fact, we're still going to be working this same eccentric control of the wrist extensors. However, this is a TheraBand Flex Bar. You can twist it, you can bend it. It's a great tool to use that I recommend for my patients dealing with this lateral epicondylitis or tennis elbow, because there are multiple exercises you can do. I'm just going to show you one of them. When you buy the Flex Bar, it does come with different exercises that you can do. But this, what you're going to do is you're going to have your wrist extended on the wrist that's affected. So I'm using my right wrist here. I'm going to flex the wrist just like this over, and then my other hand I'm going to have cocked like this, and I'm going to then wring it out like I'm wringing out a rag. Okay, I've got my elbows straight, and now I've got that right wrist is extended, and the right wrist is then going to control in slowly going back to that flexed position now, so then the bar is in neutral. And then I'll go back, cock the wrist or extend it as much as you can, and then slowly that 3-second control, bringing that wrist into flexion. And so same thing, you can do this for sets of 10 to 12. Now, I'm using a green Flex Bar. You might even really want to start off with a red. It all kind of depends on where your strength is at. This is a pretty tough one right here. That can be a little bit of a confusing exercise, so if you have a dumbbell laying around, you might want to just start there. Now the next is a stretch for those wrist extensors. So what you're going to do is you're going to make a fist with the hand or in the arm that's involved. Okay, you're going to bend the wrist like that, flexing, and you're going to use the other hand for overpressure. I've got my elbow straight here, and you're going to feel a stretch all through here, just like this. You're going to hold that for 30 to 60 seconds, and then relax, and perform that 2 to 3 times. So those are some of the top exercises that I recommend for my patients dealing with tennis elbow. Again, I recommend if you've been dealing with this for a long time that you get in and get seen by a physical therapist and get a specific plan for your needs specifically. I hope you find this helpful and beneficial. Thank you so much for tuning in. Have a great day.